welcome back to Health in Today's Women. Tonight we're discussing a very important topic, and that's heart disease in women. And we're very blessed to have Dr. Britt Mioton, an invasive cardiologist at St. Thomas Heart's program at Middle Tennessee Medical Center in Murfreesboro, Tennessee. Our first segment, we talked about some of the things that cardiologists do. Now, in the second segment, I want to look at some of the tests that cardiologists use to help people evaluate heart disease. And I want to start off with a stress test. And you'll see that we have a patient here who's connected to what we call an EKG, which is basically just a measurement of the electrical function of the heart. And you can see that the person is exercising. This is an exercise stress test. And when, Dr. Mioton, I want to ask you a little bit about that because that is a little bit different. There are different types of tests. And I kind of want to start off with, first of all, when do you use an exercise stress test?
Well, Kelly, the exercise stress test or treadmill test is used basically to try to screen people to determine if there is evidence of blocked arteries or coronary artery disease.
And I know it's used in angina, and that's one of the things that you do treat. And angina, just so you get a little bit of impression, is heart pain that can be associated with blocked arteries and other things. It can be associated with a number of things. Is that correct?
Right. Angina, typically, angina is a medical term for pain coming from the heart when it's not getting enough blood flow. In women, interestingly enough, heart discomfort can present in many atypical ways.
Okay.
It's much more typically in the chest in men. Women are particularly difficult to diagnose just based on their symptoms. They may present with breathlessness, they may present with jaw pain, back pain. So as a cardiologist, when we visit women in the office, we have to be particularly attentive to any kind of unusual symptom, shortness of breath with activities that they used to be able to tolerate, not just chest pain.
And do y'all usually use exercise stress tests with them? Or I know there's different types of stress tests. I know there's there is the thallium stress test also, the nuclear stress test.
The basic stress test, interestingly, in women is actually relatively inaccurate. So for better diagnostic purposes, when we're screening women to determine whether there's a likelihood that they have blocked arteries, we usually use a stress test that has some imaging component with it, whether it's a nuclear scan as a thallium stress test or cardiolite stress test, or an ultrasound scan, which is called a stress echo. And that gives us a different modality that we can use to measure the heart's function above and beyond the EKG in women. And it increases the accuracy of the test significantly.
And you gave me a great lead into the next test that we all often use, and that is the echocardiogram. And we're going to show a little bit of footage now of the echocardiogram and how that's done. And one of the things I want you to see about this footage is this is an ultrasound. And I think a lot of people get very afraid of the whole idea of echocardiogram or echo when they leave the cardiologist's office because they're afraid of what this actually means. But you'll be able to see that this is really just an ultrasound of somebody's heart. And as you start looking at this video, you'll notice also that you can see the different blood flow through the heart. That colored Doppler that we're seeing, like you see on the Weather Channel, incredibly, right. We use it in medicine to show the blood flow going through the heart. So that's something else we want to show you when you're looking at this video, that you can see that. You mentioned a little bit about, when is an echocardiogram used? I know when we talk about stress tests, we're talking about electrical function of the heart. When we talk about echocardiogram, now we're starting to talk about anatomical or structural portion of the heart. Is that correct?
That's exactly right. The ultrasound, whereas the treadmill or stress test type technology is used more to make the diagnosis of the presence or absence of blocked arteries in the heart, the ultrasound is used more frequently in people that may present with symptoms of breathlessness, or in people in whom you feel that there may have been damage in the past and you want to quantitate that damage by directly looking at the heart muscle and seeing which parts of the heart are working properly and which aren't. It also allows us to evaluate people that have evidence on physical exam of valvular heart disease, where there may be calcification in the valves to the point where the valves don't open properly, or where the valves may leak when the heart pumps. The echocardiogram, and particularly the color flow Doppler, gives us a very accurate image of the heart, and we can quantitate the amount of leak in valves if there is a problem there.
And he mentioned one thing, that's calcification. Sometimes, and let me make sure I'm saying this right, you can actually get calcification or hardening of those valves. So when they open, they don't open properly, and you don't get as much blood flow through each one. Is that correct?
That's right. That's right, Kelly. All of us, as we age, the valves begin to thicken a little bit. It's just a function of age. In some patients, for reasons not always perfectly clear, that process is a little bit more advanced, and the calcification begins to sort of impregnate the valves and restrict the valve's motion. And in some patients, it gets to the point where it's a life-threatening problem, and the valve has to be replaced.
And that's another thing I want to mention, because it's something that, you know, we do certain things here and we don't do certain things here. And one of the things I want to say that we don't do, you are not a cardiovascular surgeon. And I think that's important. You are a cardiologist. And tell me a little bit about the difference, what the difference between a cardiovascular surgeon and a cardiologist, an invasive cardiologist is.
Well, cardiologists are medicine doctors. We, as invasive or interventional cardiologists, we do procedures where we can open arteries through needle sticks and through catheters. Cardiovascular surgeons are surgeons who've done extra training specifically in the area of performing bypass surgery or valve replacement. It's a totally different specialty, medicine physicians versus surgeons. And
interestingly enough, I'm kind of a little bit between the two, because being an obstetrician, I do both.
Right.
But I think that's important. You know, y'all are doing some great things here with just doing the balloon opening, and I think that's important that we bring that out. One other thing that I kind of wanted to mention to you is, y'all, just very briefly, you do cardiac catheterizations. We've mentioned it several times. We do have a cath lab here, and that's basically placing a camera inside the vessels and watching it, and then placing balloons and stents in there, correct?
Right. It's through, it's done in a special lab where there's some x-ray equipment, and we can actually visualize the arteries as we pass dye down them, and we can, through those catheters, actually pass the equipment into the artery across a blockage and insert a balloon and a stent and open the artery.
Well, we really appreciate the fact that Britt's come with us tonight. When we come back, we're going to look at some ways to prevent heart disease before it happens, and maybe won't need all these invasive tests that are out there. We'll be back after these messages.